For people who haven't heard of Ayurveda or yoga therapy, can you tell us what's the difference between plain yoga and these disciplines?
Okay. Yoga primarily is a philosophy. It is a practice called self-realization. During the process of that practice, you develop some health benefits. That health benefit then used as a therapy. Also, yoga as a therapy is an adaptation of the yoga practice based on the patient's need. Example, somebody may be weakness in the leg. They may come in a wheelchair. They have to do yoga sitting in a chair. Somebody may be very short of breath. So we do the adaptation based on the patient's need. That is called yoga therapy. In Ayurveda, Ayu means life, longevity, Veda means knowledge. It's a philosophy. It is primarily a lifestyle. It is called daily routine. When to get up, how to wash your face, how to clean your tongue, how to clean your nose, what time to eat, when to go to sleep, when to drink water. This is called daily routine, lifestyle. That's why we incorporate both Ayurvedic lifestyle and yoga as a therapy for a complete health.
So tell us more about the benefits that we can get by these practices.
Okay. First, this is called a relaxation response. Relaxation response means when you are able to sit down with your spine straight, with your eyes closed, and with the hand we use called the hand mudra, gesture, slowly and slowly your body starts to relax. When the body starts to relax, you start doing a effortless breathing. Your breathing becomes effortless. When breathing becomes effortless, slowly and slowly your mind quiets down. When the mind quiets down, that is called meditation. At that level, at that state, your blood pressure comes down, your heart rate comes down, your respiratory rate comes down, blood sugar comes down, all the blood chemistry gets normalizes. Even you get better, even when you do this with meditation, we don't even feel the sensation, looks like you're not feeling anymore. Pain goes away. It is a very powerful tool to control chronic diseases. We do not ask you to use yoga therapy or Ayurveda for acute disease, like somebody having a heart attack, somebody has a tumor, cancer. Yes, we use our conventional medicine. Then we integrate to yoga practice and Ayurveda so the disease doesn't come back anymore. Or disease can be better managed. People have a better quality of life. That's what really it gives to us.
So how did you come around these disciplines?
See, I am from Indian descent. I came from India, but I came to America, US, when I was very young, and I was totally Western trained. I was a surgeon, I was a vascular surgeon, and I was exercising, eating right kind of food, having regular medical checkup. But about 14 years back, I had open heart surgery myself. I had a heart attack. And I have no risk factors. My blood pressure is normal, heart rate is normal, everything is normal. Then there is a friend of mine, he introduced me to a yoga therapy and Ayurveda practitioner, but he's American trained. So he taught me a little bit, and also my Indian background I picked up very easily. Then I saw the changes in my body. All the little changes, I was very hard, very stiff because I was a surgeon. My body starts to relax, I'm breathing better, I'm sleeping well, and all my heart test started coming normal. Once it happened, experiential, I started sharing my experience with my physician friend. And one leads to another, one leads to another. Here I am. Here. I got connected and here I am.
And we're very glad that you're here, because this knowledge, it's so valuable for oneself, but also we have a lot of yoga teachers here, and they can also provide that wellness to their students as well.
Yeah, exactly. Today, I did not talk about what is yoga, what are the yoga philosophy. I talked today how to use it, incorporate it for your health, to improving your disease. That's the thing I talked about today. That's a practice we do today.
Well, we know that you give these conferences all around the world, especially in USA as well. And I want to know from your experience, do you think that the last, 5-10 years, we have like a growth in the interest in people about this kind of disciplines?
See, in America, in USA, the yoga as a therapy is used in a department called integrative medicine. What do? They integrate the conventional medicine with the traditional system of healing. So, for example, about 10 years back, 3 out of 125 medical schools had a department of integrative medicine. Today, over 90 medical schools has department of integrative medicine. If you look at the research done, called National Institute of Health, they have a website called PubMed, P-U-B-M-E-D, PubMed. If you go to the PubMed, you can see all the research articles. Today, as a yoga as a therapy, you will have over 3,000 articles. National Institute of Health is funding yoga researches. We have an association called International Association of Yoga Therapists. We do the program, research conference, and a practice conference every year. And it is growing and growing and growing bigger in size. So there is a tremendous interest, primarily that we as a conventional physician, we are failing in your called chronic diseases. That's what we are using it as an alternate therapy.
Well, and about these conferences, do you give them mostly by speaking? Is there a practice part?
It is more practice, less speaking. Okay. Because yoga primarily we say 99% practice and 1% theory. We started with practice this morning. Whole morning before lunch we did the practice. After lunch we did question and answer. Then I did some presentation on some slides with what is yoga therapy, and we finished with the practice of meditation.